I think we can start, and Eric, you can,
We're almost there. One moment. And then
okay.
I'll go through the panelists again and look one more time.
Okay.
Lisa, you can go ahead.
Okay, thank you very much. Good evening and welcome to the November 9th board work session for the Ames Community School District Board of Directors. I will call the meeting to order and entertain a motion on the agenda.
I move we approve the agenda as presented.
Second.
Moved by Bankin, seconded by Shields Cook. All those in favor indicate by saying aye.
Aye.
Opposed, nay. Passes 7-0. Director Perez, will you please read the purpose statement?
The Ames Community School District commits to equity and access that empowers every individual to reach their full personal and educational potential.
Thank you very much. And I'm going to go ahead and turn it over to Superintendent Reisner.
Thank you. Just real quick, Director Perez, it's kind of hard to hear you, so you might want to check. You just might. Okay. I wasn't sure, but I want to make sure if you have questions, we can hear you. So thank you everyone for joining us. We have such a great group tonight of medical experts to help us have, I think, what's going to be a really rich discussion. I want to just really quickly introduce people and also kind of set the stage for what the process will look like tonight. So as you know, I want to just kind of backtrack for a minute. I came before you recently and I asked you to hear my concern around the impact on student learning, especially at the elementary. And at that time, I asked you to consider bringing our youngest learners back face to face. And I asked this because at the time we had a steady decrease in cases resulting in a community positivity rate that was really less than 6%. And I knew that with that 6%, I think it was 5.6, we would be able to still implement many of our mitigation strategies. But here we are now, several weeks later, and we're pushing 15% of positivity with a high new case rate daily. So, you know, with that rate, of course, some of those cases are our own staff. And these are just really excruciating recommendations and decisions to make during really uncertain times. But when I see our teachers becoming COVID positive, it changes our course. So don't get me wrong, and hear what I say, bringing our students back still remains a top priority, but not under the conditions that we're currently in. And so we can only bring students back for that amazing education that Ames provides if we have healthy staff in our buildings. So, you know, I think there's always that question, why would we have thought of bringing students back? Well, the reason we thought of bringing students back was because at the time, the numbers were much lower. But as we've said all along with COVID, the importance of being fluid and flexible as we learn new information and we get new data is important. And so that doesn't change tonight. But I want to say top priority right now is really the health and safety of our staff. I'm concerned with the increased rate in our buildings, and we need to make sure that we take the steps necessary to protect our staff. So as we go into tonight and we look at metrics, I just want to set the stage with the understanding that none of these can be set in stone because we are in a situation that's fluid and our conditions continue to change. So the great part about tonight is that we have an opportunity to hear from some medical experts who we're really grateful have taken time to join us. In just a minute, I'll introduce them, but to start with, what we'll do is this is a background on what we'll do. Dr. Arnold will take a few minutes just to look at kind of an updated draft. Please hear me when I say this is a draft. This can be thrown out the window. This can be ripped apart and reconstructed. We can stay with our old metrics. Really, this is the opportunity to create what you as a board really desire to have as you're making these difficult decisions. I think the most important thing to remember is that the requirement to move to online instruction, 100% virtual instruction, is 15 to 20%, with an absentee rate of for students of 10%. And so what we really need to do is look at what those numbers are between that. And what that means for our learning model. So if that's kind of the benchmark for what we can do to move to fully remote, I think that helps us kind of scale everything else. And so we'll give Dr. Arnold just a couple minutes because really we want to hear from our medical experts tonight. So I'm going to go through this list, and I can't see everyone at once. So I'll start with, we have Dr. Megan Schaefer, and she is an epidemiologist, and she has been working with some of the other school districts in Iowa, I think, as well as other agencies. And so we really, really appreciate her being here and hearing kind of from that side of the epidemiology. Dr. Passion, who is a pediatrician at McFarland and the chair of Story County Board of Health. We also have Dr. Molly Lee, DVM, Story County Board of Health member and associate director at the Center for Food Security and Public Health at Iowa State's College of Vet Med. And then we have Les White, director for Story County Public Health. We have Dr. Drake, a pediatrician at McFarland, and we have Amber Deerdorf, who is the, Amber, I hope I get this right, president of Clinical and Support Services at Mary Greeley Medical Center.
Vice president, but thank you.
Okay, vice president. I was reading my notes that I had earlier. We'll go with president, right?
I have no problems with that.
Thank you, Dr. Passion.
All right. Well, so thank you all for being here. And so we'll have Dr. Arnold share briefly. And then really we want to give you all a few minutes to reflect. Really, when I say you all, I meant our medical experts, to give us some feedback on those metrics, and then open it up for the board to ask questions. And then the board, in the end, my hope would be that you would have a discussion and be able to go ahead and give us some guidance on what you would like to see for like a finalization of metrics. So Dr. Arnold, feel free to start.
Sure, Eric, if you'd pull up, I believe it's attached to the draft of the updated decision-making matrix, number 2. I believe there's an attachment from today. Yep. So what you'll see in front of you, and for the board and the medical experts, I did distribute this to you this weekend. These are a draft of possible guidance indicators and the associated educational model that would be with these new indicators. These, again, were created based upon feedback from the medical experts as well as the board in trying to incorporate the format of the Harvard Global Health Institute and the Iowa metrics for when we're allowed to apply for remote learning, as well as historical student and staff absence rates and how those would correspond. So with that said, I'm not going to spend a lot of time because I really want this time to be your ability to discuss that. And I can go ahead and turn that over. And just as a very quick, very quick highlight, we've now moved to a risk level from green to red, looking at 2 categories, our school indicators and community indicators, which are actually the same indicators we looked before, it's just in a different format. And then with how we design this to work is we're guided by the school indicators. And However, like if a community indicator is higher than a school indicator, so for example, if we had less than 2.5% absence rates for students and staff, but our positivity was 15 and our case count was 60, that would move us from the green to the yellow risk level, and then to the corresponding educational model. That was, again, this is very drafty and fully up for discussion. So I'm going to go ahead and turn it over to whoever, back to you, Superintendent Reisner, whoever would like to go.
Sure. And so just kind of, I will open it up for some feedback on these metrics from our medical experts. I know Dr. Schaefer, hopefully I'm saying your name right, that you had an opportunity to look at these today as well. So if you wouldn't mind starting, we can just get the ball rolling that way.
Sure. Just a couple of points of context. And first of all, thank you for inviting me to this discussion. I appreciate it as much as you probably appreciate my efforts. I worked for the Iowa Department of Public Health for 9 years as the Influenza and Respiratory Surveillance Coordinator. I taught epidemiology at Drake University. I have 15 peer-reviewed publications, and was chair of Iowa's Child Death Review Team for 11 years. So I've worked in Iowa a very long time, and now I support Polk County Public Health, multiple hospitals in the metro, and 2 boards of health, or sorry, two school boards, in addition to supporting you guys tonight. I've been working on this pandemic since the beginning, and there are a couple of things that I think are difficult to work around or work with when it comes to school metrics. One is that it's an ever-evolving situation, that things are changing constantly, and they are changing in a way that we never expected them to change. As of today, in Des Moines, all Unity Point hospitals are at capacity. 2 weeks ago, the VA was on diversion. There are 9 children who are in hospitals in Des Moines, 4 under the age of 1, 4 teenagers, and 1 teenager who has an inflammatory syndrome as a secondary outcome and serious condition. We've lost 2 staff members in schools in the last week. And activity is surging to the extent that tomorrow we're having a press conference at the county level in addition to all the metropolitan emergency responders, because we have to act. So these things are happening just south of you guys. And I know that your positivity is at 14.8. I just looked at it before this meeting. And what I can tell you is this pandemic shifts and flows throughout counties and throughout the states as it has this entire time. So if it's happening here, it will happen there too. The things about these metrics, I think, to keep in mind from a research standpoint is that the threshold of 15%, meaning no disrespect to the governor, but is not supported in science. It isn't. There's no research anywhere that supports a threshold of 15% at which you need to change learning modality. And I have plenty of evidence to the contrary. Some that are maybe a little bit looser than what Harvard would put forth, maybe a little bit more realistic, but we have to kind of keep that in mind while balancing the fact that you guys have a school to run and we have children to keep engaged. And that's a really hard balancing act to do. So, as far as jumping up to 18%, there's danger in doing that. And what I'm seeing in Des Moines area schools is at a percent positivity at or above 15, the schools are already surging beyond what you're at level orange. There are already outbreaks in some of these schools 2 weeks into the fact that they brought the students together. They didn't have widespread mask compliance. And then there was complacency among parents. So we have things happening like a football team held a Halloween party. There were 2 Dowling football team members at that party. And now there are multiple metro schools with over 100 cases. So that's not a situation you want to be in. So I guess my urge to you in this is to take caution, to really think carefully about setting anything over 15. I know you have to, again, balance that 15 to 18, but I would not put 18 in this scenario. I would not go higher than 15. We're already in a critical state where we have to be anticipating the ability to move quickly into what that next phase will be. And I'm happy to provide you with literature to support what's really happening with kids in terms of transmission and community spread. One final note I make, and I provided this to Dr. Reisner and also another board member, it was just released on Friday. It was a study of 131 countries. It was the first one that I've seen that shows that the 2 things that you do as a community after you reopen that lead to increasing rates of transmission are to reopen schools and to allow mass gatherings in public. It's the first time I've seen that in literature. So we have to be really careful that maybe the kids don't see it at first, but you will see it within 1 to 3 weeks, making that change.
Thank you so much.
Mhm.
I appreciate that.
Dr. Schaefer, this is John Passion. So what is your so there's outbreaks now in schools in Des Moines
Yes,
where students actually have it.
yes.
What is just out of curiosity, what is their positivity rate of students? Like what's their percentage that are positive?
Not all of them publish their
5%?
Not all of them publish their percent positivity. I know Ankeny teachers are at 8 and their students are at 5. Waukee, Johnston, and West Des Moines all have outbreaks, and not all of them pull their percent positivity, but I can look those up real quick.
It's just more of a curiosity because we've been watching very closely as the pediatricians here in Story County, and right now, and I'd be interested to hear if Amber or Les hear of anything else. As of the last we heard, we had not had a lot of kids that had it within schools. It doesn't seem to pass a lot within schools, especially schools that are doing mass, are good at mass. So you're telling me in Des Moines that when they're masking up, they're still passing it in school?
It depends on the situation. So the schools districts that I mentioned.
Right. You know what I'm trying to get at is a good idea of how we not only how we can prevent it, and you got to find out, you know.
Yeah. No, I totally see your point. Yeah, and honestly, when I first started looking at your data, I compare you to Urbandale because you're similar size. So Urbandale's done a really good job of managing their situation. Now they've been in hybrid this whole time, and the two biggest things they've been able to do is enforce the masks and enforce distancing. So because they have hybrid and they have half their kids in virtual, they can enforce the spacing. The other big component is to maintain contact tracing and testing. We're starting to struggle with testing. So that could lead to a dangerous situation in Urbandale. But I do agree. I think it's possible with a district of your size, if you can maintain those protections in place, that hybrid's been working okay for some districts. And that's good because the ones that we're seeing surges in, they did not enforce those principles.
Interesting. Because, you know, the one thing as I think about all this, and I think about the teachers and I think about the students, right now our state does not have a mask mandate that is enforceable, but the schools can enforce masks. So in many respects, the teachers and the students will be safer in school than they'll be at home. I mean, really, if you think about it. And so, you know, so we're fortunate that we can do that. And I know we have a school board and we also have a superintendent who understands all these issues. So, and the importance of the masks. Okay, thank you.
You're welcome.
This is helpful because really we sometimes only see what's in our own little world, you know?
I understand.
Out there.
And I empathize with you guys. I work, you know, with Polk County, and honestly, they shouldn't need me, but they've needed support this entire time.
Dr. Schaefer, may I ask you a question about the data you just presented or your thoughts? I guess I'm curious if you could speak to, and looking at the metrics as they're being presented, could you speak to kind of this dichotomous idea or this binary about treating PK through 5 one way and teaching secondary another way? Could you help us understand that?
Yeah, that's a really good question. And it's not a quick one to dissect, but I'll do my best. So all of the data that we have to date does show that kids approximately 10 to 11 and under do not get as sick as older children. Now, with that said, what that means is their period of transmission is shorter, which is why we, I think, initially had the perception that kids didn't spread disease, those kids, as much as others, but they do. We found, in fact, they do spread it as easily, just not for as long. So we have that factor to consider. But again, in order to keep disease under control, you still have to maintain masks, distance, protections for staff, contact tracing, and testing. Junior high and high school, though, are a different scenario. there's more and more literature coming out supporting their experience being that of adults. Now, their fatality rates, once hospitalized, are not the same as adults, but their need for intensive care and rates of hospitalizations are similar to that of adults. Again, we don't have comprehensive information on how all of this is happening because we're tracking these hospitalizations real time. But what I'm seeing in Polk County and hearing from the hospitals is something I didn't expect, because most of those schools have only been open for a short time. So there might be a consideration for different approaches for those different levels, although you really do have to think about the community levels of activity too.
Dr. Schaefer,
Follow-ups?
you're saying that teenagers are getting as sick as adults?
Yes, and that's in literature too. I can send you some references if you need it.
Yeah, because I've been watching the MMWR and watching that, and it's really, and still it seems like, and it's been our personal experience too, that teenagers seem to handle this so much better than adults. And you're
Yeah.
telling us that they're getting as sick with the same percentage?
There's a good article in JAMA that reviewed all of the hospitalizations. Actually, there's one in JAMA and I think one MMWR. I'm happy to provide to you guys that
Yeah.
looks at the rate of hospitalization and outcomes. And it was enlightening to me too. Now, like I said, we don't have comprehensive information yet, but those studies were not reassuring. Definitely the opposite of what we thought.
If I could just follow up again. So I'm curious, going back to the distinction between PK5 and then secondary, I understand what you're saying, that you're seeing meaningful differences in the children and how they interact, how they get COVID and all that kind of stuff. Can you speak to, is there any thought or research or evidence about how the teachers in those environments experience COVID? Are teachers who are in PK5 then less vulnerable compared to secondary? Can you speak to the adults in those environments?
Well, I guess I would look at that in terms of your population of teachers, in terms of the factors that would put them at risk for acquiring COVID. So I would look at their median age distribution. If you have an abundance of teachers in their 40s, 50s, and 60s who have comorbid conditions, your entire population of teachers, regardless of what building they work in, are at the same level of risk for COVID. Now, you put teachers in a building with students full-time when you have widespread community activity, it is very likely you will have transmission to teachers. If you can maintain distancing, masks, limited instruction, have testing, contact tracing in place, then there's a fair amount of protection there. I mean, you'd almost think it was the reverse, because you can tell junior high and high school kids to stay 6 feet apart, and most of them sort of take instruction well. But with littler kids, and with the knowledge that this can be aerosolized and airborne for perhaps longer than we thought, there's still a risk. So I would look at your teacher profile as opposed to trying to ascertain if there's more risk in one setting versus the other.
Just one final question then. So are you recommending that we do keep the binary in our matrix, or are you saying that that's not super helpful?
I'm sorry, what do you mean by binary?
Between the PK5 and the secondary, our metrics seem to treat them differently. Are you saying that's something you think our board should keep, or something that we don't necessarily need?
I don't know that you necessarily need it. I think it depends on how much interaction you have maybe between staff in those different areas. You're really approaching a situation where there's so much community activity that the common learning modality is probably much easier to implement and sends a better message to the community that you're protecting all students at once. Otherwise, we get into a lot of questions about why this but not this, whereas, you know, unilaterally we know we're protecting teachers and students of all ages by picking one choice. But that's really up to yours, you know, up to you.
Thank you.
Mm-hmm.
So I can kind of jump in. So anybody else on our medical panel, feedback on our metrics?
Hey, Les, are you on?
She is, but she's having trouble unmuting. She just texted me.
Oh, she's having trouble unmuting.
She is.
Do we know, Amber, do we know what our positivity or Superintendent Reisner, do you know what our positivity rate for students is in our schools at this time? Do we know
Dr.
that?
Yep, I think Dr. Arnold may know that.
Have that?
Yes, we currently, I believe we have 6 students across the district that currently are positive for COVID.
And that could change after one day in our URI clinic, though, as you know. One of the things I found very fascinating on these, the things that Dr. Arnold sent us about the, metrics that were posted, I was really intrigued by the student absent rate or the staff absentee rate. And I'm kind of almost, I'm not sure how much, I keep going back and forth about this community indicator, the Story County 14-day positivity rate. I'm wondering, and Dr. Schaefer, if this is really outlandish for me to say this, I'd kind of like to know. But I'm wondering if we could use our metrics as not the community, but rather the student absence rate and the staff absence rate. Would that be something that we could put a little bit more bearings on? And the one thing is, nothing can be written in stone. Like, I don't know how many times we've said before, these are just guidelines. These are just guidelines. And we don't know what things are going to look like at the beginning of the year when right now, we are talking about having people back in full time. We don't know what it's going to look like. And so I don't know.
We're not now. Let me clear that up for the public. We're not looking back. We're not looking at having students full time right now. We have too many staff. We have spread among staff. And so supervision and classroom coverage is the issue right now. And in some of our buildings, we're stretched to the point of we can't continue. So
what's our staff absence rate due to COVID?
It depends on what building, but we have 3 elementaries that are above 10%. So that's pretty significant when it comes to staffing, because we don't have a sub pool. So we literally have anybody who we can going in just to supervise students. So it's not a good situation for us.
And I did misspeak. It is 5 students that are positive across the district. I'm sorry, not 6, but I just want to make sure that I'm being accurate in my data.
That's fine. Just kind of want to know.
And so then sorry, this is Taylor Drake. But as far as the staff being absent, did they transmit it through the school then, or did they get it somewhere else? Oh,
I'll let Dr. Arnold speak to that.
We are unable to trace any spread directly from the school. We don't have contact tracing to that level of people's activities outside of school, just what they do report to us. Many, I can say quite a few of them, their children were sick, or their spouse was sick, or their a relative that they visited was sick. Seems to be the common theme.
that's what we're seeing at the RI clinic versus the spread within the schools. I wish Les could tell us if there's been much spread out here for the schools that have been in session 100% all around us.
Les says the host has disabled her ability to chat or unmute.
I think she just texted and said, and I can see her. Les, are you able to unmute now?
Yeah, can you hear me?
Oh my gosh.
Oh gosh. I apologize. I wasn't able to access that. I will tell you, we did see some more activity over the weekend. We had And this is all the schools in, Story County. But basically what we're seeing is Nevada, Gilbert, Ames, and Huxley are the three or the four main ones that we see. And we had 12 cases over the weekend that were positive that we have been following up contact tracing on.
I have a few questions for Dr. Schaefer, if I can jump in. Am I interrupting anyone?
No, and board, feel free. This is your time to ask away.
Is there any relationship between contact tracing and the number of cases per 100,000? In other words, is it more difficult to have effective contact tracing the larger the spread?
No, honestly, quite it's the reverse. The sooner you can implement contact tracing, so basically the sooner you get someone tested, identified, and contact traced, identify all of their exposures and ensure that there's rapid isolation of those contacts, the better chance you have to contain. So, what we see, and I hate to introduce this parallel, but I think it's a good example. When you're a country like the UK and you put all of your resources into contact tracing and testing, you do two things. You find asymptomatic cases and you find them without them even knowing before they're spreading disease or at the early stages of spreading disease. And then you also find cases quickly and you follow up on them quickly. So the less time you have someone walking around having COVID and exposing people, the more you can contain that rate per 100,000. But what we don't want to do is push the rates to the point that public health can't manage that capacity. And that's what Polk County is struggling with now and has always struggled with, even though their focus is only on school-based cases.
But you're also saying one of the components of that is testing, which hasn't been something that's consistently done in our state or even in our country. So does that have a big impact on contact tracing because you're not picking up these asymptomatic cases?
It does. Unfortunately, it does. We need to double the amount of testing that we have right now.
And these are I have two more questions which may seem unrelated, so I don't know which order to ask them in. But the first question I have, I guess, is we're asking if we can make decisions based just on school indicators in terms of absenteeism. Do you believe that there's a direct correlation or relationship between the community numbers and the school numbers, or can we treat them separately?
That's a good question. Definitely interrelated. A different sentiment a couple of months ago before we really had some school data and before we really reopened schools. What we're seeing now, and I'll be sure to give you this article as a reference point too, is that when you start to see community surge, you see one of two things. You start to see community surge, and within 1 to 3 weeks, you typically start to see a surge in the schools if the schools do not have those mitigation efforts in place that I've talked about before. They will influence each other. The other thing we've seen too is preemptive opening of schools at a time when the community was not contained, which leads to a catastrophic level of cases, as is evidenced with Salt Lake City. So you'll see the state of Utah put broad, sweeping strategies in place today that are really incredible, but definitely targeted to containing the serious situation they have there. So they kind of did the reverse. They opened up their schools and they had community that spread at the same time, and their schools surged within, I think it was 90 cases in 10 days. It was just a huge surge. And you're not going to see that, in your district, you wouldn't see quite that extent of spread, but the two influence each other. So if you see the community surging and you don't see that in your numbers yet, you should be preparing in 1 to 3 weeks that you'll see increases within your school. Again, if you don't have all those protections in place.
And the protections you're talking about are masks, social distancing, and contact tracing.
Yes, and encouraging people to test. And I should mention one other key piece too that Polk is really struggling with, and maybe you have too, is parent compliance. Parent compliance with quarantine. Parents taking their kids for testing when they're symptomatic and keeping kids home when they're sick. Your parent support is huge with keeping disease out of your schools too. And I know that's hard. I have 2 teenagers. It's definitely hard. but that's a big part of it too.
So you had mentioned something else too about that you're south of here and you're seeing a certain amount of statistical data and how the spread is occurring and that it's going to come to other counties. One thing that I think is significant about a university is that we don't simply have people from Story County working at our university. And the Iowa State University does test its staff and its students. And last week, their positivity rate was 21%.
Wow.
Not everyone tested is from Story County. So they're going back to Boone County and other surrounding counties and taking, and their statistics in terms of positivity are going to go back to those counties. But they certainly have an impact, I would assume, because they're moving around our community.
They do, and you're really wise to consider that. I have yet another article that shows, especially in Wisconsin, Wisconsin has been in a really critical state and has set up a field hospital, I think 3 weeks ago. Their outbreaks were driven by college campus activities, and that's something that we're just learning about now that I'm not sure we really acknowledged as a driver of community spread. So yes, you are wise to consider that, and there is evidence to support university activity affects the community.
And I do have one last question. I'm sorry if I'm taking over.
You're fine.
So you mentioned that there are studies and articles that are supporting that children in the sixth grade to 12th grade are experiencing symptoms similar to adults. And although they have a lower fatality rate, they have the same rates of hospitalization. And you also mentioned that Unity Point is at capacity.
Correct.
So is this going to be a situation where we may see increases in fatalities even among children because of the inability for them to get into hospital or hospitals making choices to what patients they take?
I hope it doesn't come to the latter, but I am scared. And I mean, there was a 13-year-old who died in Missouri. Oh, I think it was last week. I'm concerned about the 9 children who are inpatient now. Blank being, our community's resource for pediatric inpatients. Not that, Mary Greeley and others don't have capacity, but there are special situations, especially with MIS, that are specific to children that require intensive care. So yes, these are dangerous things that are happening, and they're happening much faster than any predictive model I put together anticipated.
Well, and the opposite of that is that if they take the younger patients, they're not going to take the older patients.
Correct. And let me be clear, it's not necessarily a bed capacity issue. It's a staffing issue.
Mm-hmm. Thank you very much.
You're welcome.
Superintendent Reisner. Oh, go ahead, Monique.
I just want to follow up on something Director Linkaitis asked about the matrix. I'm wondering if any of the health professionals can comment on what's in our matrix about the 6 feet social distancing. Is that adequate? Can that be smaller? Does it need to be bigger? Can you help us with that piece of it?
The interesting thing about social distancing, and I'm sure Dr. Schaefer will agree with this, is that's from old data. And now with all the thoughts that this could be a respiratory virus that is spread that way, it almost makes you think that social distancing of all the things we're doing is probably, in my opinion, one of the least important. It's washing your hands, wearing your mask, staying healthy. I like the idea of contact tracing, things like that. It's probably a good idea, but I'm gonna see at least what I've been reading. I'm not sure how much it's adding to it. Okay, that's kind of my thoughts.
I agree. I am definitely more concerned that 6 feet it's not sufficient without a mask. There's also a chance that once we see that sustained cold, like we always do in Iowa, and lowered humidity, that propensity for the virus to stay aerosolized will increase, and that will make it easier to spread. That's kind of what flu does. So yes, we can set the 6 feet as a guideline, but some of the countries that have had a fair amount of success, again, we haven't really hit winter months with this, have had smaller class sizes regardless of the distance. So a maximum of 15 in a classroom, if not smaller. I know my son attends school with a classroom of 4, and I'm okay with that right now. He's a hybrid student. But as it gets colder, that scenario could change, and CDC is reviewing literature about aerosolization now that the World Health Organization has put forth. So that could change.
I have a follow-up on that. But first, one thing I think we should make sure we're all on the same page for. We said a couple of times this idea of if we follow mitigation strategies and if we had masks and things like that. This board in no way, I think, is ever going to allow mitigation strategies to be lowered. So I don't even think we need to have an if on those things, because that's an absolute. I think we've been clear on that from the beginning. The one question I had is, if I remember right, and this is Superintendent Reisner, one of the reasons we had been considering the separation and how we treat PK5 and the higher grades is really because of the social distancing, right? It's that we don't have space in the high schools to keep high school and middle school to keep everybody separate, but in the elementaries, because we can tightly cohort and keep people separate, that's really the differentiation there, right?
Correct. Yes.
Okay. So I wanted to make sure it wasn't about we obviously want to keep staff safe in both locations, but in some of the school buildings we can do that easier because we can keep the social distance.
Well, I guess Alan,
one question
Alan, I just want to be sure I'm understanding the point that you're making, because I guess what I'm hearing is the medical, because what you just said is that this board has been adamant that that's something that's required. And what I'm hearing the medical professionals say is actually that's not really needed. Can I just get some clarity here? Am I understanding that correctly?
No, the mitigation measures need to be made. There's no question at all, and they need to be standards that are made. The question that came up is how important social distancing is. But what is not coming up is how important the aspect of masking is. That is not coming up. And I have a gut feeling that that's kind of what Alan meant.
Yeah, agreed. And I think, and I know from previous discussions we've had, and this is more for the community members listening, I just wanted to make sure that everybody understands we're not talking about loosening mitigation standards. And at the high school level, I know the concern the high school staff had expressed was really things like social distancing, but also for, this being a respiratory disease, it's a lot harder to control and cohort groups of kids at that level because they're moving around a lot more. I think the idea of supporting staff and that idea of maybe having that differentiation can be a good one, because there are some reasons there that make sense. A question I've got for the medical professionals really is, because it's a thing we've got to deal with, and when you look at the data, it's always happening. I'm concerned about it in the next couple of weeks. If we use metrics based on positivity, we are completely beholden to whatever Iowa State decides to do with over-testing or under-testing. And I mean, them announcing that they will give free tests to students before they go to Thanksgiving, how many tests do we expect to be dumped into this pool in a week and a half? I mean, are they going to test thousands and thousands of students and drive down our positivity, even if we have the same community spread numbers? Does anybody know, or how we should be thinking about that?
That's a really good point to make. And I'll just interject that that's why I think you lean more heavily on your rate per 100,000, because your denominator is going to be static. Now, what we're seeing now is definitely a surge with our surge, but we didn't really see much of that in late summer. So I don't think people were quite as alarmed because they didn't see the percent positivity go up. But I mean, I can tell you the state right now is at 1,238 per 100,000 for the last 14 days. It's, in my opinion, an absolutely unacceptable measure. How could we be that high? The White House task force, not the new one, the present one, says anything over 100 defines you as a hot spot. So, I think your red zone is right. That is the highest level we should accept.
Agreed. And I mean, that's kind of the point I was making is I've always thought that really the cases per 100,000 is the real number, because you can't play with it as much. The other number you can play with a lot and very easily. So kind of the final question I had in the three that I had thought of, concretely, if you look at the matrix we're proposing, what changes would any of the medical professionals here on the call recommend? You know, like for example, the daily case numbers per 100,000 averaged over 14 days, and the rolling case number average. Is that one look good? I mean, positivity rate we've talked about, and we know we're kind of handcuffed a little bit because the numbers we have there really are based on, and even those, if I read them right, aren't completely legal with the state. And our legal suit told us we can't touch that one. So kind of what recommended changes would people have for the matrix as it's written there?
I'll just throw in my 2 cents because I only have about 10 minutes left. And maybe you're opposed to this, but I would honestly collapse your yellow and orange and just make it very straightforward. Just under 2.5, I think you could even set that green level at 5 because you're going to have your normal levels of disease and flu and norovirus and things that happen. Set that at 5%. Your 14-day positivity also 5%. Less than 20 is a very admirable goal. We've never been there, so I don't know that we'll see that. The lowest we've done is 64, so there's a maybe. For yellow and orange, I mean, this to me is the heightened alert that we need to prepare for surge, but hopefully it won't get to red. That would be, you know, greater than 2.5 to 10, and actually you probably have to extend that to 14.9 given the governor's requirement. And sorry, that's for 14-day positivity. Your case range there would be, you know, 21 to 100, and then anything over 100, any 15% positivity, 15 or higher, and then your absence in excess of 10%.
So would you say that we should emphasize more the absence rate or the positivity rate, or give it kind of both equal, because it can be really different?
So just so I understand, you are bound legally that even if you hit 15% positivity, you cannot change modality unless you hit 10% absence or greater in students and staff. Is that right?
Correct. The way that it's written, it says students. It doesn't say staff, but districts around the state have gotten approval when their student absentee rate is lower than 10%, but their staff's is 10% or higher.
Good.
So we are under the impression that we would get that approval if it's staff above.
Okay. So then my suggestion would be you weigh on the community indicators as your canary in the coal mine. So if you see your positivity increasing and or the 14-day per 100,000, you see those rising over time, and they're starting to reach those levels of concern, that would be the time to prepare to request the waiver as you see absence start to happen in your schools. What I'm seeing right now that I expect we'll see if this even subsides in December is it'll happen very fast. So you'll have staff absence happen very quickly. The schools might take a little bit longer, might take longer to get kids tested, to identify their illness is different, you know, manifests more mildly in younger kids. So that could be slower to go. But I'd say your community indicators prepare you for action. Your school indicators make you take action.
Now that's an interesting way of wording that. The school indicators makes you change what you do, and the community indicators tell you to get ready.
Yes.
I kind of like that.
Good. Just a suggestion.
Yeah,
I like that too.
So this will be the Schaefer rule. No, I'm a very practical man, and when I look at, that's why I was so intrigued about this student absence rate. As a parent, I would say, well, gosh, if we don't have enough staff for our kids to be taught, I could be all in favor of cutting back schools, you know. But if we do the proper mitigation measures and we can keep these numbers down, then it could show us that if we're keeping our kids safe at school, that we can continue to do this. And if it gets out of control, then we're going to have to back off. Dr. Schaefer, before you leave, can I ask you about that rapid test that we've been hearing about?
Sure.
Our next, our county over offers their school district offers a rapid antigen nasal test. They take it themselves, or I think they might spit into it, comes back very rapidly. Is that a good test? You know,
It's not
I
amazing.
I don't know anything about it.
Yeah, it's not amazing, but honestly, just like flu, the more disease you have in the community, the better it works. So right now, it's probably working pretty well. You know, as an indicator to detect low levels of disease, no, but it's definitely good in a pinch, and it's good with as much prevalence as we have right now.
Interesting. Okay.
Yeah.
Because I know they've been using it very aggressively to keep teachers out who don't feel good. They go get the test. The school district offers it to them for free, and they make a decision about whether they can go to school and teach kids.
That's interesting.
It's intriguing.
It is. Well,
But they're a
I've
smaller
seen.
district too. They're a smaller district than us. You know.
Okay. Okay. I've seen more false negatives than false positives from that test and the PCR.
Got it.
Yeah.
Okay.
Dr. Schaefer, I know you have to go soon, and I wanted to just ask one final sort of clarifying question based on when you talked about how you might change this matrix. So you mentioned collapsing the yellow and orange categories on those guidance indicators. And I'm wondering then on the educational model, would you recommend that the green would be the 100% in person, that collapsed middle yellow or orange or whatever would be hybrid, and then the red would be remote?
Correct.
Okay. And that would be hybrid for all students, correct?
Correct. I mean, I think you do have some flexibility given the size of your district if you want to, you know, continue to parse that, but definitely up to you.
Thank you.
But you also said to take the 18% out, didn't you? You said that was too high.
She
Yeah,
did.
it's too high.
I got that note.
Is this guidance school to school though? Because it's not for the whole district. It's school by school, depending on the rates, school indicators. Is that right? Because it doesn't say that in here.
I think if you go by school, I think there's going to be a need to go by school at times, because we could have a low rate somewhere, but we could have, like we're seeing now, we have one building that's at 10% absenteeism and we have one that's at 5%. So, you know, I think we're going to have to do it in some cases school by school, because that's the only way we would be able to move into a more restricted, a remote learning setting.
I might just suggest that the school indicators indicate that it's a school by school measure.
Sure.
Now, the 18%, that's the one we can't change, right? Because that's the governor's one?
The governor is 15 to 20%.
If we have absentee rate above 10.
Correct.
So absentee rate's not above 10 until red.
Right.
So I guess then we can go to 15. Yeah, that's going to be a weird one in there.
That'll be really weird. Yeah.
Okay. Because really we're restricted on that one column.
Yep.
One follow-up I had for Dr. Schaefer then, because the one that I can't find any research that actually says for sure, is the case rate per day. So red at 100, you think is research-based and reasonable?
It's, this is difficult to answer. It is not the appropriate measure for reaching community containment. It should be lower. It is a more appropriate metric for the level of community containment that our government is willing to commit to at the present.
But that could change.
It could change, yes. Yeah.
Because,
and when it
because
does,
that's the one that's, yeah.
We can come back to this if by chance that changes.
I'm sorry, I have to sign off. It was wonderful meeting all of you virtually. Please let me know if you need anything else.
Schaefer. Okay, I'll be in touch. Thank you.
Thank you.
Okay, so we have about 5 minutes left. here's my thought as we move forward, unless somebody else has a different thought. But my thought is take what we heard about. We can go ahead, collapse those, take out the 18%, clean up the language there. I think it was Director Lankaitis that suggested that, and we could bring it back.
I guess I was trying to ask a question at the end. I'm still not clear of, I heard one of the reasons was in terms of clear communication, but in terms of collapsing the yellow and orange, if any of our, and I know we lost Dr. Schaefer, so she doesn't have an opportunity to provide clarity, but if any of our medical professionals that are still on can provide clarity on what the benefits are of collapsing those and what might be some challenges with that.
I'm not, the collapsing, I think that to me, it seemed like it was more of a simplification issue. The thing that I took away from all this was, and I don't think I'm misrepresenting, what, we've heard here today, but it really sounds like we have to kind of look at the school indicators to make decisions on a day-by-day or week-by-week basis. And that the community indicators, and I kind of like the idea, 14-day positivity rate. I've been watching that just because it's an easy one to watch. But there might be a good point to say that the 14-day total case rate per 100,000 might be a little bit more accurate. But that you look at the community indicators to get ready and the school indicators to decide what to do.
And is that district-wide we're looking at that, or school by school? Because essentially, I mean, by collapsing yellow and orange.
I think it has to be school by school.
So you're in favor of, we wouldn't have a district-wide decision. Is that what you're saying?
Yep. I mean, it seems to make a lot of sense to me because you don't have students going back and forth between schools, at least during the school year.
Sure.
Yeah.
Lisa, I think that Dr. Schaefer said that we can combine yellow and orange because she would increase the green to 5% from 2.5%.
Okay.
So you would get all kids back in earlier to 100%.
Thank you for clarifying. I was trying to figure out, I was missing that piece, Michelle. Thank you. Thank you, Dr. Passion, for clarifying that too. I appreciate that.
Right.
Any other questions for the medical team?
Dr. Lee, we haven't heard from you. Have you you've been hearing all this stuff and you have a great access to the literature. Have you been do you have anything to say about kind of the things you've heard?
Yeah, you all heard a lot of really good information from Dr. Schaefer. I agree with a lot of what she said. I haven't seen the literature either to support that those benchmarks greater than 15%. Of course, I recognize the legal aspect of that as well as playing into your decision, but really just kind of recapping things that have already been said that I think are maybe the most important is that you need to be the reason why you'd probably move between these indicators is more related to protecting your staff as opposed to your students, because your students are going to lag a little bit behind that. Your school indicators probably will lag a little bit behind your community as well, but kind of in pandemics and in disease outbreaks, you're always going to know if you didn't do enough soon enough, but you won't always know if you waited too long. So I think that's really valuable to look at the prepare to be ready to move to 100% online learning is one of the most important things to look at in that benchmark.
I have some feedback I'd like to ask for. I guess I apologize if I missed it. I'm still not clear. Are we now all talking about PK-12, or are we still doing PK-5, 6-12?
I don't know that I think that if I'm understanding correctly, that would be a conversation that we would need to have.
That
I
was
guess
the same
I'm
question I
asking
had. Yeah.
from the medical professionals, I'm asking them, because I thought I heard Dr. Schaefer saying it should all be the same.
Yeah.
So for the medical professionals who are still here, if you could give us your thoughts on that.
That is exactly what she said. The literature that I'm aware of shows that children between 11 and above tend to get this as much as adults. Now, I have not seen the literature about them getting as sick as adults. But again, things are changing in this country, so it might be out there. I didn't see it. What we're starting to get inklings of that children may not be as contagious as long because it goes through their system very rapidly, but they can still be as contagious. Again, clinically, we have so far, but again, this changes really rapidly. We have not seen that spreading that kids do. I mean, we do not see the children spreading it to other kids. We just haven't seen it. Now, I saw a bunch of kids today in our URI clinic. I did COVID testing on virtually everybody. We'll see if they all came back positive. You know, may have a different sense of that after today. But in the past, we have not seen that yet. So that was her point. I think she wanted to put everything together because while the little kids might not get as sick with it, they're still concerned that they will pass that on. So that's why I kind of wanted it. I think that was her point that she was trying to make. And I'm not sure if I agree with that, but yeah.
So I guess
I think she said it really depends on your population of teachers at some level too.
Right.
And their age group.
And she did talk a lot about that.
And would you then all agree, because I guess part of what I also heard was it wasn't so much about the social distancing, although I'm not saying we're getting rid of social distancing, but the masks, hand sanitation, and then what I heard was it wasn't necessarily about the social distancing, it was actually more about how many people were in the room. And so if you can keep the numbers down because of how much stuff is in the air, that's what we need to focus on. Is that a good way to think about it?
In my opinion, that would be a very good way to think about it.
So then like if we have a classroom that has like 30 kids in it, that will be a no. But if we had classrooms that have 15 kids in it, that would be a yes. Is that where we're at, or what number should we be thinking about?
I'm not sure. Everything has to be what you can do, and but again, I still continue to go back with my impression of the importance of proper mask wearing and an intolerance to someone not wearing a mask appropriately. Give them a warning, then send them home if they're a teenager. Most of the teachers that I've talked to in my office have said that the little kids are tolerating the mask wearing perfectly fine. They're taking direction perfectly fine. There's always going to be kids with developmental issues that are going to have problems with masks, but the greatest majority will not. And I think that has to be kind of the emphasis of the school. It would be really nice if everyone was only in a class size of 5 kids. That'd be great. But I don't think you're going to be able to do it, ever.
No, that's not going to be possible.
So, but, so if the choice is in between a class of 15 or 30, if you can do the class of 15, do it. But the question that you're asking is, should you not go to school because you can't make a class size of 15? I'm not sure that's the right answer.
So just to kind of recap then, would you like us to go ahead and move forward, make those changes, collapse? We'll make it, I think what I heard was some consent. I think I heard some consensus, but I could be wrong on the PK-12 idea. And so we can go ahead and make that PK-12, do some work on this, and then bring this back at the next meeting.
And
I
we
guess
need
I-
to change the 14-day positivity rate to 5% instead of
Yes.
the 8.
Yep.
Cool.
And the 18 to 15.
To 15. Yep.
Okay.
Yep.
Are we still going to make this by school?
I guess that was my question is, thank you, Dr. Drake, for asking that. I'm wondering how we will go from making this school by school and how we will manage that, number one, as a board, but number two, more importantly, as an administration.
I think it's a really good question that you pose, because one of the things that, today has brought is just a lot of what feels like spinning, because there's that timing with how do we bring it to the board quickly enough that we can go into the mode of notifying parents. You don't want to notify parents until the board has acted on it, but yet we kind of have to, because parents need to be able to plan. Is that what you're referring to? Is just that decision making, how that happens? I can bring recommendations based on the metrics. I mean, that's not a problem. It's just, I don't know that that's efficient as we go through.
I'm just trying to think through. So what I'm hearing is if we are guided by our school information, so our school indicators. So what I hear then, and please correct me if I'm wrong, then so the green is less than 5%. So any of our schools that have less than 5% student absence rate or staff absence rate due to COVID, those schools would be 100% in-person learning. So we could have, under a school by school model, we could have some schools in full in-person learning, some schools in hybrid, and I'm going to create the worst picture, and then some 100% remote. Is that what we're saying? That's what I'm hearing when we're saying going school by school, and I don't know if that's what we mean.
Well, we've got school by school, some going out remote and some hybrid.
Or we will have.
Correct, sorry.
That's okay.
And
So
prior
will we
to this recent surge, what were the numbers like? Would you have had the majority of schools all online or all hybrid? I mean, have they been fairly consistent throughout the schools, or does it vary quite a bit?
Dr. Arnold, you look at the data minute by minute, so I'll let you answer.
Our student absences have come nowhere near 5% on a multiple day basis. I think the highest we got was maybe 3% on one day in one school. Our staff absences do vary across the district. We were looking at total staff illnesses today to incorporate both the COVID impact as well as just illness on staffing ratios. And that does differ by the building kind of greatly, depending on a lot of factors.
Even prior to this recent surge, though, like 4 weeks ago, was it still very varied?
I don't think the variability was as high because we weren't seeing as much activity. So it was hard to see. I mean, yes, you could say it was, but one case versus 0 is different. You know what I mean? Versus 6 versus 2,
I guess I keep going back to something Dr. Schaefer said about that, how the spread or how the two influence each other. So if you are starting to see a lot of cases among school-age children and among our staff, really, that means that we're surging, like you said, Amber, we're surging as a community. So I guess I wonder if it doesn't, I mean, to me, from the administrative side, it seems like it would be easier to have one to go as a district. So if our indicators are this, then we go online. Just kind of to manage the logistics of that with transportation and all of those pieces, because it seems like if you're hitting those levels in a building or two, it seems like it's only a matter of time before you're going to hit them in the other buildings.
The concern,
agree.
I think, oh, sorry.
Oh, sorry. No, I would agree with that. I would imagine that it would be somewhat of a chain reaction, that it would be maybe a day late or two, but I think district-wide would be more efficient.
So that is a little concerning to me because we are nowhere near having the district-wide number of absenteeism with staff. Yet we can't cover the buildings.
I hear
So
what you're saying. Yep, that makes
we don't have
complete
enough
sense.
staff, which is
Right.
why the governor and the Department of Ed said you can close building by building, because you're going to have a surge in a building that's not going to get you the number you need to go online for the whole district. So I'm not quite sure what I do in the meantime to cover.
No, that makes
so maybe what
complete
we
sense.
we do give you that flexibility, right? That we don't have to put them in the guidelines, but if you will see that, you will see one, if there's 2 buildings, right? Then you do those 2. If it's all the buildings, so that would be good for you to have that flexibility.
For sure. Yeah, I think that's a must, because we can't have rooms not staffed.
I just want to raise a concern, an equity concern. I know that there are 3 buildings right now that are going to go, potentially going to go remote. I can't remember them right now, but my sense when I heard them was those were our some of our most vulnerable students attend those schools, right? And so I guess I want to just point out that I don't want to create a system in which students who are, as we know, the hardest hit by COVID, the ones who are now also experiencing the least equitable educational opportunities. So I guess I'm not arguing one way or the other, but I'm just saying if we are going school by school and it's continuously Mitchell, right? It's time to reevaluate.
Mitchell is not one of them.
That was just an example. But you understand what I'm saying, right? Like, I think I understand structurally why we would want to go school by school, but then when you look at what's happening in these individual schools, there's a reason you wouldn't want to go school by school, and I don't want that reason to be overlooked.
Sure.
That's a really great point. For some of the kids, especially the ones that go more than 3 days, the ones that maybe go 4 days a week or go 5 days a week even, is there a possibility of getting them served at a different building?
We have that taken care of, because what we did at the beginning of the year when we were when we were in fully remote, students who had been identified for additional services, they were still served at the building. So that continues. Those are some decisions, that we don't have, certain decisions we don't have choices in it, because we need to provide as much service for those students. So yes, that's already built into it, that those students would still be served at the building.
Okay, thank you.
Sure.
I think Director Bankin brings up a really good point. And to me, it's an argument for using the community indicators, because that does make it equitable across the district. If we use the community indicators, and that is what CDC recommends, that is what Harvard Global Health recommends. I haven't seen anything else out there that is recommending going by the school indicators, except for the state of Iowa. It seems like just going by the community indicators, we'd be able to keep it equitable.
I guess I'd be curious to hear from because it does not, when we were talking about the school by school, then that gives some recognition for the lower transmission rate among our younger students. So I'm just curious because I know that, Dr. Passion and you have spoken about this. I'm curious what your thoughts are for us on that, and treating our Because if we don't go school by school, then we are treating our elementary building the same as our high school building.
Right. I personally like the idea that the school indicators be used for action and the community indicators, whatever you decide to choose, whether it's 14-day positivity or 14-day total case rate, is the indicators that you will use to get ready for action. And I like the idea of going from school to school. It would make a lot of sense to me that if a K through 5 school has a low student absence rate and a low staff absence rate due to COVID, and they're doing a good job of keeping masks on those kids, keeping classes as small as possible, making sure the teachers are not going out to parties at night, they shouldn't be closed.
One thing that we had proposed in this indicator, these new metrics, would be that kind of a combination, right? So that we're guided by the student and staff indicators, but if we had 20% positivity, but still only had less than 5% student absence, we might think that we may not want to be 100% face-to-face. We may want to be hybrid at that point, or, you know, following. So that's why in some ways there is an advantage to at least acknowledging both and letting one lead and, you know, the other help couch that.
Yeah, I go back to that with our state not having a mask mandate that you can enforce that, but when you have a mask mandate that you can enforce, that the teachers and students are actually safer in their schools than they are if we keep them at home.
Kathy, the thing you just pointed out, if we collapsed orange and yellow, we lose that a little bit, don't we? Because
Yes.
You're right, you did bake that in to have the community indicators be able to move the school indicators one notch higher.
And I think you would still have that. It would just be, there would really only be the one level in between. So if we had a less than 5% absence rate and a cases per day of 110, then we would be in the yellow, the hybrid.
Yeah, the thing we lose though is the orange. Like we lose that you have a really high positivity and a really high case rate, but you have a low absentee rate. You know, yeah. I don't know. I'd really like to see the, I'm having trouble in my head thinking about what this matrix actually looks like with the changes that have been proposed. I'd really like to see that before I say anything more on whether they're good or not.
Mine's so marked up, I don't even know what I'm looking at
So to move us forward, would you like for us to do to make those changes that we talked about initially? I think I captured everybody. I think I have it down. Kathy, Dr. Arnold, between the two of us, I think our notes, we should be able to come up with that. Would you like us to prepare that and bring it back?
I'm going to say yes and no, and I'm going to make a proposal that the board may or may not like. I don't know. So part of what I feel like is that we need to get this done. And this is a complicated conversation, and this is not the best way to have it. I'm wondering if the board would be open to, this might be an opportunity for an ad hoc committee where I guess it could only be three. Is it three? Three board members could perhaps volunteer to work very closely with the superintendent in getting this ready to bring back where we can kind of get moving. It's just something I want to throw out there.
I kind of like that idea. And I think I've heard some frustration in the community about the amount of time that has been spent on this, rather than just doing something like saying, you know, we're going to follow CDC, or we're going to taking something that's already there. I would like to see it get done quickly, like Director Bankin said, and I'm open to, you know, if a committee can help get it done more quickly, whatever we can do to get it done quickly. So we can get, especially as we're seeing this surge and all of this uncertainty, the community really wants to have something where they can sort of start to understand and predict what might be happening for them in terms of planning.
I would support that. I think the one thing the board should do tonight then to help that committee is, and I think we possibly have, but we need to be clear as a board for that committee. Do we want to have any differentiation between the younger grades and the older grades? Because that's the first question that'll come up.
I'm going to say no.
I would lean towards no.
I would also lean towards no.
I lean towards no.
No.
I'm actually in favor of it, and I'm struggling with it in listening to our medical professionals here why we would not have it different. But I'm clearly the minority.
I feel that
I'm on the fence about it because we haven't heard from the principals, and Jenny really completely on it. You know, like Superintendent Reisner, what do you think about that? Because you made a strong argument 2 weeks ago, or no, 4 weeks ago, right? That was needed because hybrid is failing our youngest kids.
Yeah, it's probably a much bigger discussion, but if you look at some of the academic research that's out there, and we've talked a lot about the medical research, but there's a lot of academic research out there that points to early grades and online learning not being an effective delivery model, but it is more effective as students get older. So I just think there's a lot more that, and you know, the research has changed, and I think there's probably a lot more work that we need to do, and it's probably more time than we have tonight to get into that. I just would really urge us to strongly consider this being building by building. That's my greatest concern, because I don't know what we do if we don't have the staff to supervise students in a building. So we're there right now. So like we are.
Well, I mean, that one seems pretty simple to me. You have to close building by building, but you could maybe open by community. Right? I mean, there's no way around it. If you don't have staff, you have to close building by building.
No, well, I think originally there was discussion around the metrics being district-wide, not building by building. And I just am saying that we would be very, I don't know how we would.
Yeah, and I want to, since I was one of the people who said that, I just want to offer a clarification. So, you know, thinking about it, using the school indicators, I absolutely would do whatever is easiest for staff. Okay. You know, I was thinking about it that maybe that causes more difficulty for administrators, but, you know, clearly from what you said, it's actually far more difficult if we don't go that way. The only reason that I was saying to not go building by building would be only if we used just the community indicators and took the school indicators out of it.
Oh, okay. Okay. That makes sense. I got it. Got it.
And your concern about
maybe
K through 5 are going to be handled differently. I think if you go by the school indicators, you're going to find K through 5 will be handled differently. That'll be the reality.
So I guess that's my only thought, because I still feel very strongly about just monitoring it. And so perhaps if there is a ad hoc committee that comes together, you know, one of the little bullet points could be, you know, school by school asterisks, you know, unless, you know, one school's got 3 times in a row, we maybe need to reconsider. That's all. I don't want a school to fall through the cracks because we just weren't paying attention to that.
Great. Yep. Well said. Okay.
So I support the idea of an ad hoc committee.
Okay, so I will have JD start working on pulling that together, and I don't know if Elisa, if you want to, if there's people that want to volunteer, or if you want JD to send something out asking.
I guess I will actually take membership. Is there anyone that wants to volunteer?
I would like to volunteer.
Okay, I would like to be on it. Anyone else?
I volunteer Alan.
I do too.
Great job with the
See, I was going to volunteer Sabrina, but I couldn't decide whether to volunteer Sabrina, Michelle. I wanted to volunteer somebody, but I guess you got to me first.
Well, I already
Okay.
volunteered, Alan.
I was going to volunteer.
Yeah, you did it quick.
Alan, you made such a good spreadsheet. Darn it.
Oh,
Okay,
that's
so I
always the
have
problem.
So smart.
I have Sabrina, Elisa, and Alan. Is there anybody else?
No,
That's
I
all.
was just wondering, what exactly is this committee doing and how long are we, because what are we doing in the meantime? What we, so
That's a
I,
very good question.
I could answer that just from a standpoint of, in the meantime, I'm following the state, the Department of Education, in absence of kind of a defined, so staying in hybrid for everyone, not making any changes right now, staying in hybrid for everyone. And then if we need to move into a more restricted environment, then I'm following the state guidelines for what we can be approved for. Does that make sense?
My only point of clarification, Superintendent Reisner, would be that we do have our meeting tomorrow because we do have 3 schools that we are looking at that are because of the staff absence rate. So
That
just
fall
making
within
sure, yes,
Yep.
so making sure anyone who may have just tapped in from the public, yes, that is, except for those 3 that have fallen in the staff absenteeism category of needing to move 100% remote.
so, so we're saying hybrid now. So we already, so for the 23rd, we're bringing everyone back. So where we stand on?
No, because if we get approved, good question, and that's, we're going to try to make this clear at tomorrow's meeting. If we get approved, which I would assume we will get approved for the 3 buildings at this point, the 3 buildings that will be going to hybrid, that's a 2-week approval window. So that'll take us through that Thanksgiving break. So within the motion that we set for tomorrow, we also added language about that we would delay any return to face-to-face instruction for all PK5 until further notice. I mean, we said until further action. So does that make sense to everyone? We can explain it again tomorrow, but okay.
So point of clarification for the public, all 5 elementary schools will be mentioned in the motion tomorrow. Only 3 at this point looking at a change of delivery model. Okay, and that meeting's at 3:00 tomorrow.
To Director Colton's point, though, my sense about what this ad hoc committee is going to do is that they're going to work with the district to kind of get these get this matrix hammered out, because this isn't really great for them to do that. And so once they get that, then it will come back. My sense is it would come back to the board, not that those board members would be in charge of finalizing them. That's my sense.
Just cleaning it up.
Timing.
Yes.
And to the timing you asked about, Director Colton, I would think we should bring it back by the next board meeting. Well, not by the next board meeting, by the next regularly scheduled board meeting. And I would hope we can get something complete well before then, so the board can review it and think through it.
Well, so that, just so that we can, I appreciate that. So we can,
yeah.
What?
Yeah, you're going to point out that we don't have a regularly scheduled board meeting for a while, right?
Well, yeah, I mean, I'm worried. I'm just worried that that'll put us out, because we bring it back for discussion and then we don't act on it till the following board meeting. So that does kind of create a long delay.
I think we've had sufficient discussion on this topic, and I think we are narrowing to where we need to be. So I am seeing some head shaking, and I think that we can move with it can always be tabled. So when we bring this matrix to it from the ad hoc committee, because it can always be tabled. I don't think that this committee is going to, throw the draft out the window and start over. That's not my perception of what's going to take place here.
Okay.
Okay. Is there anything else that you wanted to talk about during the work session, Superintendent Reisner?
Nope,
Any
that's
other
it.
questions from the board members? I just want to say to our medical professionals, thank you so much for being here. We know that, I don't know how many of you have provided feedback to working with Superintendent Reisner and Dr. Arnold, but we really appreciate your willingness to be here with us and to share your perspective with us, because it is very much appreciative. So thank you very much. I will
Agree. Thank you.
You're
Thank
welcome.
you.
Before we go,
Thank
I
you.
need somebody to adjourn the meeting, please.
I move we adjourn.
Second.
Second.
Moved by Beerbaum, seconded by Perez. All those in favor indicate by saying aye.
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 Opposed, nay. Passes 7-0. To the community members, we vote to everyone. We are on this same Zoom. Board members, if you want to hit mute, maybe stop your video, and let's just take a quick 3 to 4 minute break. We know JD will start the 3-minute timer on me, but a 3 to 4 minute break before we go into our regular board meeting. Thank you.
Okay, thank you very much. Can I have a copy of that, your new metrics as you rewrite that? Would it be possible?
Yes, of course.
Absolutely.
Yes.
I'd appreciate it. Even, you
Now
know,
we will
I don't have to make any
continue.
comments about it, but I'd just like to see it.
Thanks, Dr. Passion.
All right. Okay, guys, thank you very much. I'm gonna head out.
Thank you so much.
You know how to find us.
Yes, we do. Thank you.
Bye.
All right, do we have everyone? One, two. Okay, I think we've got everybody back, so we will go ahead. And Eric, are you ready?
Ready to roll.
You're ready. Okay, thanks for hanging with us. All right. Good evening, everyone, and welcome to the November 9th meeting of the Ames Community School District Board of Directors. I'll call the meeting to order and entertain a motion to approve the agenda.
I move we approve the agenda as presented.
Second.
Second.
Moved by Benkin, seconded by Lenkaitis. All those in favor indicate by saying aye.
Aye.
Aye. Opposed, nay. Passes 7-0. Director Beerbaum, will you please read the purpose statement?
The Ames Community School District commits to equity and access that empowers every individual to reach their full personal and educational potential.
Thank you very much. And we will go ahead and go to our COVID-19 report. Superintendent Reisner, I'll turn it over to you.
Thank you. So just a quick update on where we're at with our local conditions. Dr. Arnold.
Sure. Eric, do you want to pull up the doc? Thank you. And scroll in just a little bit. So you can see in front of you, our local metrics, our 14-day positivity is 4.8. Our 7-day positivity is 15. Our 14-day case rate per 100,000 is now 60.9. As far as school metrics, our student indicators, we currently have 5 students in the district positive for COVID-19, 44 that are quarantining due to close contact. As far as staff, we have 7 positive for COVID-19, 21 quarantining due to close contact, and 6 pending tests. For the school, 0 of the staff quarantines are related to in-school exposures, and 3 of the student quarantines are related to an in-school exposure. And then we have currently 3 schools that are at or approaching 10% staff absences, and that is Meeker, Edwards, and Sawyer. And that is all.
Is there more? Could Eric scroll down? We can't see. Okay. Thank you.
Dr. Arnold, can I ask a question? And I guess this is more, if this is something that would be possible. We've had some emails today since the notification went out about the rates, the absence rates in the schools and the need to recommend moving to remote instruction. The metrics on the website they lag because they're only updated weekly. Is it possible to update those more frequently especially as we're going into this surge period?
Yes, it is. They probably, due to other related surge factors, they probably won't be able to be updated until later in the day, but that is a possibility, yes.
Thanks. I just think that would be helpful for the community because they would see that number going up and maybe be able to prepare.
Okay. Any other comments on that? I never quite know. It's hard on Zoom to see if I gave enough wait time. So
I'm sorry. Oh, go ahead, Gina.
You want to finish?
See, I didn't.
I forgot one other related question that I had written down. And this was a question that came from a community member as well. And this might be something that we're restricted by HIPAA, but FERPA, is it possible to break down those numbers by building? If we're talking about going by building with these metrics, is it possible to put building by building on the website too?
I will have to check into that. I know that currently a lot of it has to do with public reporting and an ability to report specific numbers. I believe we can report percentages. We're limited to our ability to report any values of less than 6.
Thank you.
With those numbers trending upward as quickly as they have been, do you have an anticipation for if and or when it might reach the threshold where we go online only for the whole district?
Dr.
Yes, yep.
It's getting there. I mean, it's doubled since our last meeting, so I'm just curious.
I would say that the numbers continue to concern me. They do continue to grow at a rate, when I guess to be clear, the question is, when are we going to hit 20%, which would be if we're following the state guidance. I would not be surprised. I would love to be proven wrong on this, but I would not be surprised if before Thanksgiving or even sooner, we may hit that level. But that's just based on looking at the data and where we have been heading. That is completely a slightly educated guess, but I do feel that I do not feel we're going to currently plateau right now where we're at.
Okay, I was just asking for your opinion, so not formal numbers. Thank you.
Okay. Learning model enrollment update.
I can speak to this and just say it's been messy. We are still cleaning up the last 2 weeks' data to make sure that we have accurate numbers. We had 11 students today request to move to remote campus. And over the last 2 weeks, we've had a big surge in students wanting to come back to our hybrid model and then transition into that face-to-face based on the numbers. But since things that are happening in our community, we also have families just like we are as a board and as a district trying to make really informed decisions. And so we've had students that requested to go one way, now requesting to come back the other way. So as soon as I have those numbers cleaner than what they are right now, I will share those with you in the same format that I have in the past.
So Director Mixdorf, you're seeing that going both ways then? You're not seeing a trend in just one direction?
I see more of a trend in the request to come into our on-site model. So our hybrid and our face-to-face. What we had originally said was face-to-face. For example, in our elementary remote campus, we have 92 less students in our remote campus than we did a month ago. So last time we transitioned. So we saw pretty big requests to come back. But then what has been happening over the last 3 or 4 days is now I have families that are requesting to come back to that remote campus. So I have students counted in twice, and I need to get in and clean those numbers up so that I'm giving you accurate information. We had 13 students today request to go to a remote campus that were either requesting to come hybrid or were already in our hybrid model. That's been our biggest daily request for quite a while. We were 0 to 5 here pretty consistently for the last probably 3 weeks or so. So starting to see that trend back up.
Okay, thank you.
You're back.
Okay, any other questions? All right, winter sports update.
Good evening, everybody. I've been watching here for the last hour and 15 minutes, trying to get updated information on today and where we're at as a board and our community and everything. But I just wanted to present maybe about a 3-minute overview of winter sports and then open it up for a few questions. But we've got 6 sports, 2 that have started today, and then the other 4 will start next Monday. And I've got 6 coaches that are locked in right now, really taking this serious. We're throwing everything we've got at this with my office, our athletic training staff, to support mitigation efforts, to educate, to enforce, to promote, to do everything we can to get off to a safe start here. daily as we start practices. The CIML athletic director group, we are now meeting almost weekly because things are changing in our districts. We are modifying and changing and brainstorming weekly. We have another meeting scheduled for Wednesday in 2 days. A lot of us have board meetings tonight that we're going to reflect on and adapt. I go back to, we're 6 months into this now with athletics, way back to our summer sports and now our fall sports, and that I want this to work for the sake of our kids having some normalcy, for their need to compete and be engaged in extracurricular activities. But the more I've learned through the last 6 months, it's their mental health, it's their challenge to do something for the sake of their well-being and their mental state. I'm seeing that and hearing that as I talk to our athletes more and more, to try to preserve sports as long as we can in a safe manner. You've got an attached document tonight that has all the details of where we're at from our governing bodies, with the Girls Union, the Athletic Association for the boys, the CIML conference. We're wearing masks as much as possible. I think that's the biggest thing we're trying to monitor and enforce as deep as we can into our activities where it's safe. But, you know, Dr. Jenny and I talked today and Dr. Nyberg, and, you know, I want to continue this on and for another 2 weeks, knowing that we evaluate this decision every day with Dr. Arnold and our administrative team above me and our CMLAD. So right now we're just in practice mode. We're about 2 weeks out before we get into game mode. You know, I'm trying to send a message to our community, our parents, even our coaches and our athletes. Let's not get too far ahead of ourselves here into the winter season as things are changing daily on this, and just take it day by day and work together and try to lean on the medical experts and everything that we've got to do to take the next step. So that's kind of where I'm at as the athletic director and running high school sports right now. So I open it up for any questions you may have.
Are there any ways, Judge, where you're at Ames High going beyond what the athletic union's recommendations were in the documents, or where you're finding things where you need to go beyond?
I feel very strongly, and I'm hearing it from other coaches that visit our events and other people. I think we're going above and beyond in our daily monitoring of our athletes and working with our coaches and having almost a daily check-in with our kids to talk about signs and symptoms. We're doing hand sanitizer breaks daily. We're doing temperature checks. I mean, Ian and myself, we have been out there during timeouts of volleyball matches, squirting hand sanitizer into the opponent's hands. You know, I do not want to leave one stone unturned in our mitigation efforts here for our athletes and the people in our gyms and fields and things like that. So I feel strongly that we're doing above and beyond. And I couldn't get there without the support of our McFarland athletic trainers and their guidance as well.
Are there any specific areas that concern you more than others as far as the things you have to do for the various sports?
Our concern, not only from my office and our coaches, is we feel good that there's very little spread during the school day and during our athletic practices and competitions. It's what's happening when we lose our grasp of our athletes and our students when they go home, when they leave practices and events, and what they're doing on nights and weekends. That's just our continued stressor. You know, we can't keep them in a bubble like the college and pro models are doing.
Judge, I really appreciate how great of a job our sports teams and coaches and everyone has done with mask wearing throughout these seasons. And I'm thinking about winter, has there been any talk among CIML about requiring masks? I'm thinking specifically for sports like wrestling. You know, our athletes wearing masks is only going to go so far when the other schools are not. So do you have any thoughts on that?
Yes, that'll be a discussion point Wednesday. But we talked today that that's going to move forward to the next step, that we're going to require that when these teams come to the Ames High gym or swimming pool, this winter. So that will be addressed from my desk Wednesday to our CMLADs.
And I guess I'll just ask one more question then. I was looking ahead at tournaments and things and the guidelines for attendance. Are those, I assume that those are all based on those schools being operating in some sort of face-to-face capacity, whether it's hybrid or fully in person, that those tournaments would only be happening if the schools were in an in-person model of some sort?
Yes, that's the only way the union and association will allow them to compete against us. But all the tournaments that are on the books right now for the winter sports have been downsized drastically to limit the number of athletes and fans that potentially will be in our gyms and other gyms that we're competing in as well. So that has gone way down. But again, that may be adjusted even further as we're all dealing with the increase of activity here and making better decisions moving forward.
Really commend, will judge you as well, but I really commend our coaches for the job they did this fall. I know that they had to put a lot of work in, and the steps that they took extra time and energy, but I really, really appreciate it. And I just feel like they were a model for the state.
And I appreciate that. Yes, I do agree with that. And this is not a knock on my fall coaches, but I feel like my winter coaches now, we're having just deeper discussions on what ifs and how can we do this better and how can we pod kids and how can we stretch and train differently to minimize risk. And that's good to see that they're taking it serious to try to preserve this as long as we can.
Okay.
I was just going to say, Judge, thank you for your efforts, you and your coaches. And I think that the thing I hear when you say it's what happens when you lose grasp of the students. And I think that is certainly was a message that we heard from Dr. Schaefer that has happened in some of the metro schools. So we certainly appreciate for you doing everything you can to control what you can control. And hopefully we can continue to get the message out to our family members and students that it's your behaviors outside of these controlled areas where there's great mitigation in place. So thank you for what you're doing.
Okay, thank you.
All right, COVID expenditures.
Eric, if you can pull up the attachment. So we have added, the last report was at the end of September. So we've added the month of October. We had $66,094 of expenditures during the month of October. That brings our general fund up to $399,000, $13,000 out of PEPL, and we expect to get about $100,000 back from FEMA.
Okay, any questions on that?
I'm going to just ask it. So we see for those that are out in the community, so they're seeing we've got a responsibility of $312,000. Chris, give us an idea of what that cushion is in terms of how that is taken care of in our budget.
I've moved as much of it as I can to the CARES money. We've got a limited amount of that left. The mechanics of this is that we would go to the school budget review committee in the Department of Ed in the spring, or they've even talked about adding another meeting at the end of the year so we'd know our full impact. to ask for spending authority. We won't get actual revenue for it, but spending authority is our concern. So there is a mechanism to try to get that back from in spending authority.
Thank you.
All right. And then the last COVID item was one that we talked about a while back, but things have definitely taken a turn for the worse. So, but it was the plan to return to in-person board meetings, and the board had asked me to explore with my staff what it would look like if we were able to return in person, and we may have some that would board members that still would need to participate via Zoom or some other platform. And then also, I think one of the things that we were really that we felt from a district standpoint was important was the amount of people that are having access to these meetings. We've definitely tapped into a way for people to have more access, and we wanted to look at, is that something that we could continue even if we were in person? But I do think at this point in time, it probably is not wise to come back to having board meetings in person. Not a decision that I think would be wise of us. But in the future, so that you know, I'm going to turn this over to Eric to talk through what we discovered and just our ideas on it.
Yeah. So pre-COVID, we had a system in place where everyone would come to the school board meetings in person, and we had the technical infrastructure within that room. Since then, we've developed a new system. So now we're all doing it via Zoom in this way. And really our task was to figure out how we can integrate those two systems into one. It does get a little bit complicated when we're starting to talk about integrating audio and video to make sure that those within the boardroom can see and hear those on Zoom without getting feedback. The good news is that we figured it out and we can make it work. So whenever we get to that point and we want to be able to do that, we certainly can. Essentially what we would end up doing, because we do value the Zoom, actually doing Zoom meetings this way accomplishes a lot of the things that we need as far as being able to see each other. We can present information and we can record it straight to YouTube. So really what we're going to end up doing is we're going to run a Zoom meeting. We would continue to have the community participation that way if that's the way we wanted it. If we had any district directors or school board members who wanted to attend that way, we could do that. And then for those who wanted to attend in the boardroom, we could do that as well when we get to that point.
How would the audio come through to those of us in the boardroom for the people, the board members that might be remote?
It would come through the speakers in the ceiling.
So the large speakers in the ceiling, so the loud, okay.
Yep. So essentially what we're doing is we would operate a Zoom meeting the exact same way that we do it here. So I start the Zoom meeting, and then it would require another staff member to operate a few computers inside the boardroom. So really what we're doing is that we're adding a person besides myself, and we're adding about 3 additional computers to be able to project within the boardroom, but also one that can tap into our video system within the boardroom, but then we can still run it to YouTube.
Do we have any information, Superintendent Reisner, about it, so that we can do Zoom meetings because the governor still has our emergency declaration in place, right? When that expires, or when she chooses not to have it anymore, will we run? What's the legal situation if she ends it before all members of the board would want to feel safe coming into the meeting in person?
I think that I don't know the answer to that tonight. I could look into that. Chris, do you?
Board members can always participate electronically. It's just, in the past, before we had this kind of technology, it wasn't as conducive to full participation. I think Eric's talking about that he's worked that out, but we've always been able to have board members call into meetings. So that is nothing new. I think the difference is we would most likely have to have a quorum in the boardroom if she does not continue the emergency proclamation and allow electronic meetings. Does that make sense?
Thank you. Yeah, that was my exact question. I didn't know what the rules with the open meetings and stuff for that would be.
I'd be curious to know, not to go into the weeds too deep here, but I'd be curious to know if during a global pandemic, if there would be some type of waiver for people who are experiencing underlying health conditions, or to make exceptions for that quorum. It seems like there would be. I don't know that that's even something we need to worry about now, but just would be something to explore too. We can work on that a little bit.
I guess I would assume if we're still in the global pandemic that she'll continue the emergency proclamations.
We would hope.
So Eric, I want to make sure I'm understanding this. So in terms of community participation, they would be able to participate remotely still the way they do now in our meetings, but potentially, if we got to the place that it's safe, could also be in person. I know that this is not right away. I know what our percent positivity is right now. I'm just trying to understand. You could do both formats for a member of the community.
Yes, I think when we get to the point where we want to have conversations about being back in the boardroom, then we would have to collectively talk about, do we limit number of people?
Yeah. Right.
Where are people going to be seated? Our task over the last, really, it was the week we did testing, was to figure out how, from a technological standpoint, how do we integrate these two systems? So that's what we focused on last week. We
thank you.
Integrate Zoom with our equipment in our boardroom.
Awesome, thank you. And I know there are more conversations that would need to take place on that. I just wanted to understand in terms of the technology that it would accommodate both modes for our public. Thank you.
All right, that is the last COVID item.
Okay, board members, any other questions for Superintendent Reisner and her staff on COVID-19? Okay, I will go ahead and read our statement regarding comments on public, comments from the public on discussion items, as well as our public forum. Residents of the district, students attending the district, parents or guardians of students attending the district, and district staff members may address the board about any topic relevant to the district, whether on the current agenda or not. Those who wish to speak must sign up at the beginning of the meeting. Speaker participation is limited to 3 minutes once per item. The views and opinions of citizens addressing the board do not necessarily reflect those of the board, district administration, or staff. Speakers are to remember that Iowa law prohibits the board from discussing specific employees, students, or their performance. Student speakers will state their name and school. Others will state their name and address. And as a reminder to our public, this is an opportunity for individuals to make a comment about the COVID-19 only, please. And sorry, I'm getting myself organized. So go ahead and raise your hand. I see we have no one with a hand raised. Sorry, I'm not on the screen yet.
No, Jenny.
There we go. Sorry, we do. Okay, Jenny Coffey, you've been given permission to talk. Are you there, Jenya?
Sorry, can you hear me now?
Oh, now we can. Go ahead.
Good evening. My name is Jenya Coffey, and I live at 4257 Eisenhower Lane here in Ames. I'm a teacher at the middle school, and I do have a son who is a remote student at Sawyer. But tonight I'm speaking on behalf of Ames Youth and School Action Team, or ASAT. ASAT was established in January of 2017 and is a nonpartisan and apolitical group of concerned citizens with allies across the Ames community whose intention is to shine a light on racial and ethnic disparities that exist throughout the Ames Community School District. Since COVID, every school board meeting has begun with a COVID-19 update, in which the district updates the board and community about the current public health data in the county and within the schools, along with any state level mandates. ASAT would like to ask why there is not an update on the educational status of students from every building during these updates. Disaggregated data, including performance measures, more specific attendance and engagement data, and any plans or action steps for improvement could similarly be presented at each meeting. This would provide the board and the community a better understanding of how students are functioning academically and emotionally under all the current models. ASAT remains focused on ensuring that educational equity is a priority within Ames Community School District in its actions, not just its words. ASAT wants to be clear in this request. A plan needs to be established and executed that ensures educational equity regardless of the delivery model. We cannot know or predict which model we will be following from month to month, but we can accurately say that our marginalized students have been underserved in our 100% face-to-face model for years. The achievement gaps noted during COVID were also present when the students were 100% face-to-face before COVID. Therefore, it is unclear how a return to 100% face-to-face instruction ensures educational equity. What would be different? How would that help? What are the goals to improve students' educational standing that would be furthered by a full return to the school space that couldn't be accomplished before COVID? Similarly, parents have the option of keeping their kids in the remote campus if they do not feel safe sending them to school. If that is truly a choice for parents, then it is imperative that the district has a plan for meeting the needs of all students in their chosen model. We appreciate the attempts made to allow certain students to come to school more frequently based on specific needs, but if families choose to stay remote for safety, these students still must receive a high-quality education. Time needs to be spent to determine specific student needs and a plan of action established to ensure that benchmarks are met. As school conferences were eliminated this fall, specific plans for each student should be communicated to each guardian. When the FAST and MAP is taken in the winter and/or spring, data should be presented to include growth data from fall 2020 that shows what progress has been made, not just whether or not they meet the benchmark. We would like to hear about how the district is working with organizations such as the Boys and Girls Club and Readers of Story County that can assist the district with academic gaps. Above all, we would like to hear a clear plan to address our educational crisis. Thank you.
Thank you, Jenya. Any other members of the public who would like to speak, please raise your hand. Again, this is on COVID-19 only, please. All right, I am seeing no additional hands being raised, so I will go ahead and move us on to our discussion items. And our first discussion item this evening is our enrollment and budget impact. And go ahead, Chris, I think you're good.
Okay, so we have our first piece of the puzzle for the fiscal year 21-22 budget, and that is certified enrollment. So we wanted to take a few minutes this evening just to update you where you are. Hopefully everyone can see that on the screen. It looks a little small. Oh, thank you, Eric. So I'm just going to briefly go through how certified enrollment works, and then how it impacts our budget. The main thing I want you to keep in mind as I go through these numbers is not to think of these necessarily as kids, because obviously if you look at the first line, we don't have a 0.3 or a 0.4 of a kid. This is how kids are counted. And some, depending on what program they are in, sometimes they are counted as a full student and sometimes they are counted as less than a full student for budget purposes. So that's why you see those partial numbers there. So the first line of this summary is kids that live within our district and are attending our schools and receiving their education from us in one of our programs, whether that's remotely, whether that's face-to-face, whether that's in our homeschool program. So those are kids living in our district, receiving their education from Ames School District. The second line, and you'll see that that count went down 160.1 students. Mm-hmm. So we had 160 less students receiving education from Ames students or from Ames schools this year than we did in the previous year. So current year is the fall, as the October of 2020 count. The second column is October of 19, October 1st of 19. The second line are kids that live within our school district but are receiving their public education from another public school. You will see that that went up 34.8, and you would hope that a positive number is better than a negative number, but in this case it's not. This means that there are 34.8 more kids that we are counting, but that we are going to send that money to other school districts. So that is actually a negative impact on our budget. The next two lines are just some partial funding that we get for additional, for students that might be dual enrolled or taking PSEO classes. So I'm going to skip those and go down to what we call line 7, which is the actual enrollment. So you'll notice that in fall of 19, we had 4,477 resident students that we counted. This year we have 4,352 that we counted. That's down 125 students. The next line are students that do not live in our school district, but receive their education from Ames schools. So these are open enrolled kiddos. And you'll see that last year we had just under 520 open enrolled in students, and this year we have 453. So that is a decrease of 66.3. The next line is preschool, and I'm not sure why they put it where they put it on this summary, because it doesn't make sense. It's not counted in the next line, but this shows you how many preschool kids. Actually, preschool is 0.5. So if you want to know how many students we actually have, you take those numbers times 2. So 126.5 would be the number of pre-K 4-year-old students that we have in either at Northwood or one of our preschool partners. Then the next line is generated by taking line 7, subtracting out line 2, the open enrolled out kids, and adding in the line 8, our open enrolled in kids, to get to where the number of school age kids, not pre-K, but school age kids that are receiving instructional programs from the Ames School District. So last fall we had 4,811 students that were receiving, school age kids that were receiving instruction from us, and this year we have 4,685. That is a decrease of 226.41 students that we are serving this year. And that is the number that is important for budget purposes. Any questions on certified enrollment and how kids are counted? Again, I want to emphasize this is how we count kids, not what we would normally think of kids in seats.
Do we
I have
know?
a question. Oh, sorry, Michelle, go ahead.
Do we know why we're down 160?
I'll go ahead and I can speak to that. We have many of the school districts, the larger school districts, we've all seen the decrease, yet the smaller districts that didn't have maybe the level of, let me just say, the small school districts gained students. And so I think that, you know, there were parents who were looking for school to be face-to-face full-time. And so they went to neighboring schools that could offer that resource. So I think that's one of the things that, and Chris had heard it in her group of school business officials. We had heard about it in our superintendent's group, and then we got the data that we looked through that supported that. And there are districts, all of us, the more urban, are down quite a bit.
We also did have a large, I'm sorry, I was getting an echo. We also did have a large increase to our homeschool assistance program. And so if they were not in the homeschool assistance program last year, but receiving their education in one of our buildings, they were counted at 1.0. If they went to our homeschool assistance program, they're still receiving their education from us, but they're counted at 0.3. So you can see that for every student that might have went to the homeschool assistant program, we lost 0.7 of a student. So that's another contributor to that decrease.
I guess when you went through this, I thought the 34.8 were the kids who are resident are students who decided to go to another school district.
Yes, that is correct.
And then we lost 125 kids who were open enrolling from other districts. So is 125 plus 3480, is that the 160? I can't do math that fast, so.
Right, I can't point, but if I could, you take line 1, thank you, Eric, and you subtract out line 30 or line 2, and then you have to add those little ones in between there, but that comes down to the 125 students. So those are the students that we're going to count on our count and get money for. That's how much we're down. So we count open enrolled out kids. The state sends us the money, and then we turn around and write a check to the other districts. Okay. So then the next line is our open enrolled in kids. So those are kids that other school districts are going to count. They're going to receive the funding, and then they're going to turn around and write us a check. So when our open enrolled out goes up, that means we've got less money that we're going to be able to keep, and we have to send other districts. And when our open enrollment in goes down, that means that that's less money other school districts are going to send us. So to get to the full budget impact, you take the 125 and you subtract out the 3480, and then you add in the 6630. So that gets us to a negative 226. It's harder when you're looking at it on the change. If you do it on the actual numbers, it makes a little more sense.
I guess I should have just asked my question a little more simply. I was trying to get at, is there any reduction in enrollment that's not COVID related? Like people just simply leaving the district for, they moved away? Or are we attributing the whole loss to people leaving because they wanted their kids enrolled in schools that were doing things differently than Ames?
I'm sure that Barb would have, because the only way we would know that is if there was a records request and that they physically moved to another school district.
Dr. Hawkins.
Yeah, I'm just going to hop into the conversation really quickly since I work really closely with Barb around open enrollment. And I can tell you of the open enrollment requests that I had. We do keep a record of those, of course. I do not recall one request that came through particularly past June that had anything to do with anything other than COVID related. Superintendent Reisner described it particularly well. There were lots of folks that wanted to go to a district, maybe neighboring, that offered 100% face-to-face learning as their starting model.
So the question I've got then is, line 1 then, to be on line 1, that's not about open enrollment. That's like physically leaving the district. Right.
Right. So that's either they've moved to physically moved to another school district. They've gone to maybe St. C's. They've gone to some sort of competent private instruction. So whether that's either our homeschool assistance program or whether it's independent competent instruction, which means you're just homeschooling and you're not involved with the school district at all. So you're correct that as far as that, unless they told us that they were leaving to go to St. C's or to go to homeschool assistance because of COVID, we wouldn't necessarily have that data. As far as if they physically moved to another school district, we would, because they would have had to have a records request to send their records to another school district.
Understood. Thank you. That would also be the line, like if a family, it'd be the same thing. Like if they homeschooled a kindergartner, held back a kindergartner or something, that's where it'd show up effectively.
Yeah, if it's a kindergartner, it's not going to be reflected in our numbers because they wouldn't have been in our previous year numbers. They would have possibly been in our PK numbers, but they wouldn't have been in a keeping a kindergartner and saying, I'm going to wait a year to do kindergarten wouldn't reflect in our enrollment numbers.
And reflect in the aggregate though, because you'd have kids that roll off when they graduate as seniors that then don't get supplementally replaced with new kids coming in.
That's another good point, Director Beerbaum. That reduction might be from graduating seniors as well. And then if you do have those kindergartners that chose, or the parents of the kindergartners that chose to wait a year, those two things would compound.
Just one more question to make sure that I'm understanding that top number, Chris, based on what you just said. So if a student is in the homeschool assistance program, they're counted in that number, but just at the 0.3.
Right. They may have been a 0.1 in the prior year and a 0.3 next year.
So then some of that change down would be related to those students as well.
Yes.
Okay.
Thank you, Chris.
So now I need to move on to the budget impact. So Eric, pull up my, oh, okay, thank you. You'll go to the next page. So this is where those numbers from the previous page, you can kind of start seeing how they impact through our budget. So the first line there is enrollment, and you're going to see that decrease of that 125 that was from line 7. So our certified enrollment that we're going to receive funding from the state went from 4,477 down to 4,352. Now I am assuming at this point 0% state percentage of growth, and we'll talk about that a little bit, but I think we're all, we'll all be surprised if we get any kind of significant state percentage of growth. So I am assuming that the district cost per student is going to stay the same. So if you just looked at raw numbers, our regular program dollars. Now, this isn't any weightings for special ed. This is just counting special ed kids as 1.0 kids. It's not any of our ELL weightings or any of those. This is just regular program dollars. Would have went down $892,000. Now, there's something within the state aid formula that, that I haven't had to think about for at least 10 years, and that's called the budget guarantee. There's a mechanism, and it's to protect declining districts so they don't have to absorb those kind of revenue reductions in a given year. And the budget guarantee basically says that you are going to be guaranteed 101% of your prior year regular program dollars. However, you have to levy that entirely with property taxes. So the budget guarantee will be $1,210,000. So that would bring our regular program dollars up to $32,188. That makes our increase in revenue $318,000. And you can kind of do the math and see that that's 1% of the prior year regular program dollars. So that's that 101% guarantee. But again, that will be 100% property taxes. So we'll have to look at how that, once we get valuations in and see what else they do as at the state for funding, see where that leaves us as far as the tax rate. Now you go down to loss from open enrollment. Now, even though our count went down 125 instead of the 160, we have 34 or 35 of those kids that we're going to have to send that money that we're receiving up above to other districts. We do not get to keep that. In addition, we've got 66 less kids that other districts are going to send us money for. So the amount of funding that we're losing from open enrollment. Now, open enrollment is always on the prior year cost per student. It's so even if they give us more money per with state percentage of growth, this number will not change. It will stay the same always. We're going to lose just under $720,000 from open enrollment. That leaves us net new regular program dollars of a negative $400,000. Now, one of you might say, and I'm not going to share my screen, and because I know it's been a long meeting already, but someone will say, well, yes, but what if we get state percentage of growth? That might help us. Well, I did this for the budget and audit committee to show them that what happens is if, say, we get 1% state percentage of growth, that budget guarantee would go down to, say, 800,000, but the total amount of new money doesn't change. It doesn't change until we get to 4% state percentage of growth, and then we would get an extra $20,000 of new funding. But up to 3.9% of state percentage of growth, this number will not change. Any questions to this point? Okay, you can go to the next page, Eric. So again, this is what you're normally used to seeing from Superintendent Reisner when we get through budget as the preliminary new money budget. Now, nothing's on here because we haven't started looking at any kind of budget modifications whatsoever. But what I did do is bring that negative 400,000 over from the previous page. And I said, what if we just have a modest increase in salaries and benefits for our staff? A very modest increase would be just under $800,000, would leave us negative $1,200,000 before we start looking at any budget modifications. And now I feel like I'm the Grim Reaper.
So the impact is, it's our change in enrollment essentially that is impacting our budget forecasting for the next year.
It is, except that the change in our enrollment is guaranteed by budget guarantee. So the main impact is the loss of the open enrollment, both more kids out and less kids in.
Yeah. Jenny, last week when I was on the UEN during the annual meeting, and they didn't give me much hope for this, but I'm curious if you know anything more today. They were talking about that there was some efforts, some desire to see if there could be a second count day, that there may be some shifting. And I'm not doing a very good job of clarifying, but my understanding was if they would do a second count day at the start of second semester. Can you is there any hope for that from your perspective?
You know, I don't know in terms of, Chris and I have talked a lot about this. I definitely, Chris can explain some of the details. I don't see much momentum with it right now. So I would guess that there won't be a second recount. It wouldn't help us very much.
Well, and it's the interesting thing about is that meeting was last Thursday night, and we can see since last Thursday night how the data for positivity and some of the case counts have shifted. So I think that what they had commented was that maybe it was an opportunity for some of the urban schools to recoup some of those students as some of the metro schools were trying to get more face-to-face time in. Obviously, that the current state of Iowa right now may not provide much opportunity for movement of students. So
yes. And Superintendent Reisner and I had this conversation, and I told her I didn't want to rain on her parade because I knew the superintendents were talking about it. The issue is that there's already mechanisms within the formula that have been built in for loss of students. So the budget guarantee is one of those. So they've already said you're going to get 101% of your budget. The problem is if we gain students, then another school district that's counted them would lose those students. And so but they're serving those kids this year. So if you remember, well, maybe not. I guess it's later in this meeting. There's a application to the School Budget Review Committee that allows us to get spending authority in real time for those open enrolled out kids that we lost. Now we haven't had that in the past couple of years because that's not what's been happening with our open enrollment. But the last couple of years, we've gotten spending authority in real time for our increased enrollment. So my guess is that the legislature is going to say there's no reason for this second count because there's already mechanisms. If we get all those kids back next year, because remember this funding, we're not serving those kids right now, but this funding is for next year, is for 21-22. So we got money the money we got for the 2021 budget was based on much higher enrollment, but we're not serving those kids. This enrollment is going to be for the 21-22. So we may serve more kids next year, but there's a mechanism for us to get spending authority in real time if our enrollment increases. So is anything possible? Yes, but my guess is they would say no, that it would be because districts have already counted kids and they might be moving back to another kid, whether it's open enrollment or not. Plus, if it's up to the serving district after the deadline, whether they let those open enrolled kids come back to us. So unless they were coming from like St. C's or from homeschool assistance back into full service, that money wouldn't follow either. So I just don't see much hope of that.
Sure. So essentially what we're looking at is, and I don't want to take words, but in a very watered down fashion, we will be charged, our Superintendent Reisner, you and your staff will be charged with presenting us with a budget that is $1.2 million less. And we may gain students back next fall that have left, but we still have to create our budget around these losses, but we can go at that time, then go back to school budget review committee so that we can recoup that money next fall should we need to make adjustments due to having additional students we had not been planning on. Is that a very fair thinking?
Yes, very, very well said. Yes. Yep. All right, is that it, Chris? Is that your happy news for the day? Thank you.
Yes, I
Thanks,
think that's
Chris.
enough.
Thank you.
All right, any other questions on the enrollment and budget impact? Seeing none, I will open the floor for any members from the community who have anything related to, go ahead, Alan, I hear you.
I have one question, and this is, Chris, do we have any estimates of the impact yet of COVID on SAVE funding?
So that's an interesting question. So SAVE funding is based on kids that you count, not kids that you serve. So the fact that we lost the 66 open enrolled in kids does not affect SAVE funding at all. The increase in open enrolled out does not affect SAVE funding. So the way that line 1 is how they determine that line 7 is how they determine SAVE funding. So in any given year, we get the money for open enrolled out kids for SAVE, and we don't get any money for open enrolled in kids for SAVE. So I did have to send the enrollments to Bond Council and to Tim Oswald at Piper Sandler once we got the certified enrollment. And we had to do what is called a parity check to make sure that we still had the coverage for our bonds, and we did. So as far as the projects that we've got on the books at this point, no, we don't have a problem because we have the bonding capacity that we need.
I guess what I was thinking through is, and maybe I'm getting SAVE and Pemble confused, once in a while I do, but it's tied to sales tax.
Yes,
correct?
SAVE is sales
and I've
tax.
heard that I've heard a lot of cities are really worried about sales tax changes this year as far as the amount of revenue coming in from a sales tax funding source.
Yeah, I can understand that. Schools are distributed a little bit different. They take the statewide amount of sales tax and they divide it equally by students. That's why I went through that exercise of who we get money for as opposed to who we serve. So we get money for all of our resident students. Okay. At this point, the state as a whole is not seeing that impact because they just had the revenue estimating conference, and those revenues actually went up a little bit. They didn't go down as that they may not have gone up as much as they thought they were going to originally pre-COVID, but they didn't go down like everybody thought they were going to. So the revenue estimating conference was actually a surprise. They were surprised with the amounts. That is not how counties and cities get theirs. They get what's generated within their jurisdiction. So if you would have a particularly hard hit city or county that maybe lost a lot of sales tax generating businesses, it could have an impact locally in that case.
Okay, thank you.
Any other questions from the board members? All right, we will go ahead and open. If there's any comments from the members of the public, please raise your hand. Seeing none, we will go ahead and move on to the next item, which is the board committee update. And I believe Equity, your information is on there and you sent us some information to read.
Yeah, so the Equity Committee met in October and we have not been able to meet. We're going to meet again in November, but it turns out that there's a conflict with the ACSD convention. So we are trying to find another date to meet. And then just in the minutes are the attachments. Some of them are a draft of data collection tools that we might use if we decide to continue having SROs in our school, but I think more importantly is a preliminary review of the literature regarding SROs that I just wanted to be sure everybody read and to be able to answer any questions that you might have. Again, it's preliminary. It's about half the stack I had. So I still have the other half to get through, but it's been a rough few weeks. So I will hopefully be able to get that to everyone by the time the committee meets again. But if there were any questions, just wanted to be able to answer them.
I had one quick question on your data collection, the surveys that you had been looking. So you have done the surveys. Have they been sent to staff or have none of them? I was trying to decipher the August 2020 part in there.
So that's Dr. Jones actually drafted those. I'm not sure if he's on the call, but what we have found consistently is that when we try to figure out what is the impact of having SROs in our district specifically, we can't answer that question because we have no data. And so Dr. Jones was in charge of drafting a set of data collection metrics that we might use if we decided to keep them. And so it has not been distributed to anyone, and it doesn't reflect the literature. And I think that's why we decided to kind of just put it on pause. But since it had been presented, I wanted to send it to you so that you all had it.
Okay, thank you. Any other questions or comments for any of the committees? Budget
One
and
question
audit.
I had related.
Well,
oh, sorry.
Nope,
One question
go
I
ahead,
had related to the SROs, and thank you, Director Binkin, for sending all that information. As you're looking in the literature, and I'm not sure if this would exist there, from your notes, it made me immediately wonder, is there an alternative for SROs that the literature does say plays a key impact or that has been found by places that does work well? Because I think a lot of your notes really point to the idea that it's inconclusive in a lot of ways. And I just wonder if there was any positive information in the literature about things that are conclusively helpful in the ways we would want.
So I haven't seen that directly. I've seen it alluded to. And that's a hard question to answer because no two school districts use them for the same outcomes. So they don't bring them in to address the same kind of issues. And so what the literature does seem to be clear on is that we tend to see trouble in school districts that are not homogeneous. So if the officers go into an all-white school, we tend to see fewer problems. We do tend to see problems when they go into schools that are either predominantly students of color or where the students of color are actually the minority in the school setting is when we also see problems. So when there kind of is an equal mix, we don't necessarily see a lot of negative outcomes. It just depends on the environment and the way in which they're being used.
Okay, thank you.
Audit and budget met, but Chris just gave the report. So any other committees?
Teaching and learning met. The minutes aren't in here. There were a lot of things discussed, and I really think having the minutes so you can go through it will be key. I would say that really the vast majority of the meeting was really just talked about as really getting the committee rolling. It was more, I'd say, almost an organizational meeting, especially with Director Mixdorf now new to that committee. And we ended up kind of having a wide-ranging discussion of things that are the most important to start tackling soon, based upon the board discussions we've had in the past. So things like understanding engagement, understanding impact of COVID on students, and also looking at ways to get information sooner related to reading proficiency, some of the data we've all seen. But I think that'll be reflected in upcoming meeting notes, but also one of the things we made clear, some of those topics are so meaty and important that we really think there should be presentations to the board to provide that information in the future. And Director Mixdorf and Director Jones, we're going to go off and come back with some ideas about how to stage some of that, how to bring some of that forward and make sure we address those.
Any other questions for board committees? Seeing none, are there any questions from the public or any comments from the public on the board committee update? Seeing none, I will go ahead and open the public forum opportunity for anyone to comment on anything that is not on the agenda. Again, members of the public, if you please raise your hand and Eric will give you permission to speak. All right, seeing none, we will go ahead and move on to the consent items, and I will entertain a motion.
I move the board approve the consent agenda as presented.
Second.
Moved by Shields Cook, seconded by Bacon. Superintendent Reisner.
So gifts to the district: Ames Education Foundation, Ames Town and Country Kiwanis Club, Dave and Susan Tucker, Northminster Presbyterian Church, and Cynthia Jackson in memory of Wayne Hansen.
Thank you. Moved by Shields Cook, seconded by Bankin. All those in favor accepting the consent items as presented indicate by saying aye.
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 Opposed, nay. Passes 7-0. Moving on to the action items. And the first item is the reappointment of Chris Stensland as our board secretary and treasurer.
I move the board reappoint Chris Stensland as board secretary treasurer.
Second.
I'm sorry. Moved by Beerbaum, seconded by
Bankin.
Bankin, sorry. Seconded by Bankin. Discussion. Seeing none, all those in favor indicate by saying aye.
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 Opposed, nay.
Aye.
Passes 7-0. And Chris, we will go ahead and do your oath. Do you solemnly swear that you will support the Constitution of the United States and the Constitution of the State of Iowa, and that you'll faithfully and impartially, to the best of your ability, discharge the duties of the office of board secretary treasurer in the Ames Community School District as now or hereafter required by law?
I do.
Thank you, Chris, and thank you for continuing to serve as our board secretary and treasurer. All right, the next item is the proceedings to approve the sale of our revenue bond series 2020B.
So this is the continuation of
Oh,
the.
hold on, I gotta take a motion, Chris. Sorry, thank you. Anyone want to make a first motion?
Sure.
Thank you.
I move to adopt the resolution appointing UMB Bank NA of West Des Moines, Iowa to serve as paying agent, bond registrar, and transfer agent, approving the paying agent, bond registrar, and transfer agent, approving the, I'm sorry, I think, okay. Approving the paying agent, bond registrar, and transfer agent agreement and authorizing the execution of same.
Second.
Moved by Shields, Cook, seconded by Lakaitis. Discussion. Chris.
So this is just the continuation of the action we took last meeting. We sold the bonds, so now this is all the official documents, the appointing of the bond registrar, the tax exempt certificate, and then the issuance of the actual bonds.
Thank you. Any other discussion? This is a vote on roll call, so I will say your names as you appear on my screen. Perez.
Aye.
Shields, Cook.
Aye.
Colton.
Aye.
Lankaitis.
Aye.
Beerbaum.
Aye.
Spankin.
Aye.
Franzen, aye. Passes 7-0. Next motion.
I move approval of the form of tax exemption certificate.
Second.
Moved by Perez, seconded by Colton. Discussion. Again by roll call. Perez.
Aye.
Shields, Cook.
Aye.
Colton.
Aye.
Lankaitis.
Aye.
Beerbaum.
Aye.
Spankin.
Aye.
Franzen, aye. Passes 7-0. Third motion.
And we are fading fast, aren't we?
Yes, I love that you're laughing. I'm going to actually mix it up, so you better pay attention this time. Who wants to make the motion?
I move to adopt the resolution authorizing and providing for the terms of issuance and securing the payment of $8,326,000 school infrastructure sales and services and use tax revenue refunding bond series 2020B of the Ames Community School District, State of Iowa, under the provisions of Chapter 423E and 423F of the Code of Iowa, and providing for a method of payment of said bonds.
Second.
Moved by Lankaitis, seconded by Bankin. Discussion. Seeing none, voting on roll call. Bankin.
Aye.
Colton.
Aye.
Beerbaum.
Aye.
Shields, Cook.
Aye.
Lankaitis.
Aye.
Perez.
Aye.
Passes 7-0. Next item is the request to SBRC for modified allowable growth.
I move to approve the request to the School Budget Review Committee for modified allowable growth for open enrollment out not on the fall 2019 count of $253,184.
Second.
Moved by Perez, seconded by Colton. Discussion.
So this is what I had mentioned earlier, that we get spending authority in real time for that increase in open enrollment out. I apologize for the wording on that motion, but that is exactly how it is worded on the SBRC application. The next motion then is for the normal spending authority that we get for ELL instruction past 5 years.
All right, it's moved by Perez, seconded by Colton. All those in favor indicate by saying aye.
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 Opposed, nay. Passes 7-0. Next motion.
I moved.
Go ahead.
I move to approve the request to the School Budget Review Committee for modified allowable growth for limited English proficiency instruction beyond 5 years in the amount of $51,676.68.
Second.
Moved by Shields Cook, seconded by Lankaitis. Discussion. All those in favor indicate by saying aye.
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 Opposed, nay. Passes 7-0. The next item, the ACSD COVID-19 decision-making matrix revision.
I move we postpone this matter until the next regularly scheduled board meeting.
Second.
Moved by Beerbaum, seconded by Lankitis. Discussion?
I think we need to have the committee finish the information and bring it back.
You don't want to have an hour and a half discussion right now on it? Okay, all those in favor indicate by saying aye.
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 Opposed, nay. Passes 7-0. Policies for action.
I move we approve the policies as presented.
Second.
Moved by Benkin, seconded by Colton. Discussion? All those in favor indicate by saying aye.
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 Opposed, nay. Passes 7-0. Items from the board on staff. So items from the board.
Actually, I have something just real quick. Am I on? Okay, I'm not.
You're on, yeah.
Okay, I just want to just make just a brief statement to the community. I want to say that everybody is frustrated, and it's human nature to try and find someone or something to blame for the reality that we're all experiencing. I just want our teachers and staff to know that neither the district nor the board blame you for the state of COVID in our district. We have to close 3 buildings because we've been failed by our state and federal government, not because our staff is behaving irresponsibly outside of work. The superintendent, district administrators, and every single person who steps foot in our schools to serve our children is a hero as far as I'm concerned. And I want to say thank you for serving our children and our community. And that was it.
I want to second that.
Any other comments from the board? Alrighty. Items from the superintendent.
Horrible timing, but one of these days we would like to have a data work session. We have some great data to share. Erin helped Dr. Jones put together some really good data, and so we'll look for a time that we could have that. But tonight, obviously, I think we're all exhausted, and so we don't have to dive into that too deeply. But there's definitely some really great data that we have and that's been put together that I think could really help inform some of the things we thought that the data doesn't show, and vice versa. So I will work on getting something set up.
Great.
Down the road.
Okay. And our board planning calendar. So we have a meeting tomorrow at 3 o'clock. And then our next regularly scheduled meeting is in 2 weeks from tonight. But there are some items posted because over the next 2 weeks, I know tomorrow night's the equity pre-conference for IASB. And then next week, there are our different sessions. It is all virtual, but I know some of us are participating. So those are the things that will be continuing to keep us busy over the next couple of weeks. I'll entertain a motion to adjourn.
I move we adjourn.
Second. Moved by Perez, seconded by Beerbaum. All those in favor indicate by saying aye.
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 Opposed, nay. Passes 7-0. Thank you. Everyone have a nice evening.
Thank you.
Thanks, everyone.